Social Services. Rachel Delman Parsons is the Social Services Director and will be giving the presentation.
All right, hello board, and thank you. I've got a little timer, keep myself to 7 minutes. We'll see if I succeed. I'm Rachel Dolman Parsons, Social Services Director. I'm also the Executive Director for the Area Agency on Aging of Lake and Mendocino Counties, the Executive Director for the Lake County Housing Authority, Public Guardian, and Public Administrator. And why I point that out is because they're all kind of different agencies with different funding streams and different ways to operate that sit under the umbrella of social services. So they're all impacted by what's coming. So good things my staff did. This is just a high level overview. They did a whole lot more than this, but really turned it around in the last 3 years with regard to CalFresh audit to the point where the state actually recognized us for our improvements. Completed Medi-Cal recertifications since COVID hit. There was a pause on Medi-Cal recerts over the last year. We had to bring them back, and our staff got them all done within the timeline given by the state. Not all counties did that, and there was a potential for some fines if it was not done. So very proud of my staff. We succeeded in consolidating buildings. We got 3 volunteers for long-term care ombudsman. As Wendy mentioned, we're working together with probation to improve child welfare services. In coordination with behavioral health, we've implemented care court, and we became a Blue Zones employer. I'm going fast to try and hit it all. Okay. What are our areas of emphasis? I threw the last bullet on here because I could not figure out how to encompass all of the very fast changes that are currently happening at the federal level. So being flexible to try and incorporate those is kind of my last bullet here. But we, of course, always want to meet the program mandates, recruit and retain diverse and compassionate staff, continue to build agency culture that values diversity, equity, and inclusion, keeping in mind some of the more recent executive orders may conflict with that, so working with you to decide how we want to move forward. Growing our community connection and collaboration, which ties back into retaining staff. Staff want to feel like they work for a place they're proud to be at. Preparing for disaster service work. Right now is our blue skies era, so we're time. So we're working together with Red Cross and Sheriff's Office, OES, to make our plans for the upcoming year. Hopefully they won't be needed, but better to be prepared. And then there's that new bullet point. So far as the OMB memo goes, it looks like it is not intended to include Medicaid, which locally is Medi-Cal, or SNAP benefits, which locally is CalFresh, per more recent clarification from OMB. That being said, the portals for providers to pull down funds for Medi-Cal and sorry, I'm going blank, for not our programs, are frozen. So essentially some portals to pull down funding are frozen. So I have escalated that to the County Welfare Directors Association. They've acknowledged they're aware of it, and they're conversing with the California Department of Social Services to figure out what is going on there. We want to make sure people do not lose access to Medi-Cal services. Doesn't look like there is an intent to do that, perhaps a misinterpretation, and we'll keep you informed. How that is going to impact our other programs that receive federal funding is as yet unclear. And again, I'll keep you informed as things develop. The OMB action is a freeze, not necessarily taking away funding, but delaying its issuance. So hopefully it would not do away with any programs. There are some other things I'm going to touch on that is more related to more known realities with regards to funding. So next slide. Kind of ties to our legislative priorities, doing as much as possible to protect funding and program operations. I am working with the County Welfare Directors Association and other associations for other divisions to do what I can so far as advocating goes, and then those associations also are able to engage with lobbying. So federally, entirely apart from yesterday's order to suspend some federal funds, there were some proposals on the table regarding potential cuts to Medicaid. I think some kind of cuts are coming, and I'm hoping we can do our best to mitigate those. There are three that are most concerning, and that's shifting Medi-Cal to a block grant, which would reduce overall funding for the program. It would potentially result in lower payments to providers, less services for the public. Overall, no, thank you, let's not do that. So that's where we stand on that. There's also a proposal for a work requirement to go with Medi-Cal. And just from a cost savings perspective, it doesn't make any sense. The effort to implement a work requirement would not result in a cost savings. The majority of people on Medi-Cal do work. It is a program that you can be on and be middle class now, thanks to Affordable Care Act expansions. They either work or they're aged or disabled. It's not for the extremely poor anymore. And that kind of leads into the third concern. I have 48 seconds. It's not going to be done in 7 minutes. The third concern is the potential repeal of the Affordable Care Act, which allowed the expansion of Medi-Cal, which is now why half of Lake County receives Medi-Cal, why a third of California receives Medi-Cal. If the Affordable Care Act expansions were revoked, some parents would not be eligible to Medi-Cal, only the children. People who don't have children would not be eligible, and people who have middle class income would potentially not be eligible if we're back in classic Medi-Cal days. I could tell you all about classic Medi-Cal, but I don't need to tell you all the rules. There are currently also no property requirements for most of the programs. If we go back into classic Medi-Cal, people may have property limits. So repeal of ACA would be bad. We're against that. Not just for the people receiving Medi-Cal, it is not good for the community as a whole, would result in perhaps less care providers, unreimbursed expenses for care providers, probably drive up the cost of care for everybody in the county. So other things on radar at the state level, CalHR is the hiring agency that my department as well as child support are required to go through, as opposed to county HR. Under merit systems, they are free, but it is can be a lengthy and cumbersome process, and some reforms are proposed that would make that process better. Disaster funding for social services, as you know, if it is not a state or federally declared disaster, there's no funding, and yet a mandate, unfunded mandate to provide disaster service. There is a proposal out there to provide funding to counties, at least one allocated position to oversee disaster planning, which would be great. And then they're currently doing an IHSS administrative funding revised proposal. I don't think it's likely it's going to be something that passes this year, but at least putting it out there so that there's awareness of the fact that something needs to happen with regard to that funding is out there for future years when there's more funds available. We have a large IHSS caseload. It is considered medium-sized, and we are a small county, so there's a lot of need here, and we want to make sure we have the funds available to meet that need.
Before you switch slides, you have OAA up there. Can you just touch on that?
Oh,
I talked about it earlier.
Yes, absolutely. Thank you for catching that. So in the federal continuing resolution, the Older Americans Act was omitted, which provides funding to our area agency on aging and a variety of programs under the Area Agency on Aging, most concerningly funding to the senior centers to provide meals. We are going to have a special board meeting tomorrow to discuss this with the Area Agency on Aging board. We haven't enough federal funding we've pulled down enough federal funding to pay for January and February. If the federal government does not reauthorize the Older Americans Act, they may ask for us to refund those funds. We do have state funds available for January through June to make the program whole for all of our contracted services. But those are not magically appearing funds. Those are funds that we would normally pass on to the senior centers to use at their discretion, and instead they would be used for the continuation of the contracted programs. So overall, there would be a pretty big deficit in services, although we would protect the most vital. And in order to use those state funds, there would be a contracting process, which would potentially result in some delays in issuing the payments to the senior centers. As well as the fact that you can't double dip. So if later in the future, the federal government authorizes the AAA funding and we've already sent out the state funding, we can't turn around and say, oh, never mind, we're going to use federal funding for this. So it's a sticky situation. We're waiting as long as possible to see if the federal funding comes through, is our recommendation, before we shift to attempting to use the state funds.
And the ombudsman.
And the ombudsman, yes. That is also at risk of not having funding. She visits our long-term care centers, makes sure our seniors are being properly cared for. So,
And that's mandated. We are already picking up a piece of that, and that's just going to be one of the things that we're going to have to carry.
Yeah, absolutely. And it's just, I'll get to realignment in a minute, but many things are hitting realignment. Okay. Next slide, if you're ready.
Yes.
Okay. Data, which will lead me into talking about maybe some funding. So with regard to funding, talked about the Medi-Cal funds. So realignment is another thing to be aware of, because realignment funds are how we make shortages in our programs whole. For instance, the long-term care ombudsman. And as time goes on, there are more and more things that the state says, oh, use your realignment for that, right? It's an unfunded mandate, well, use your realignment. So coming up will be the foster care rate changes, and that is all going to be realignment. We're entering into IHSS negotiations, and while providers absolutely, deserve good pay, that comes out of realignment. So figuring out how to balance that with everything else that comes out of realignment is going to be a tricky situation. Foster care, a variety of programs are funded out of realignment. Medi-Cal, when we exceed our allocation, which leads me to the fact that I did put a hiring freeze in place for my department, effective the 21st. It's more kind of like a hiring frost. I'm making exceptions. All of the social worker positions are still being flown and filled because, they provide vital services. We're just trying to be more thoughtful about what we fill and how soon we fill it, because many positions in my department hit Medi-Cal. I think some kind of cut is coming, and we are already on track to exceed the 24-25 allocation. We typically make that whole with realignment funds, and although the governor's January revise seems to indicate realignment will be higher than anticipated, I don't think it took into account the fires in Los Angeles and the fact that he has waived tax filing until later, which will hit realignment in a not a great way. So there's going to be less realignment than anticipated. We're going to need to figure out how to stretch it.
Rachel, with the hiring frost, what's your vacancy currently?
It is currently 19%, and that is where I don't want it to go above 20 is my goal. And we still need to be able to provide those essential services. And I'm aware of that concern. I don't want to be that guy who made us have to do the thing. So we have several do not fill positions that we are likely going to just eliminate in next budget. They're long time do not fill. Without the do not fill, it brings us to 17% vacancy. We do have an 87% retention rate, which is pretty cool. Could always improve. And we'll kind of see where things shake out the closer we get to July. Maybe everything gets reauthorized in March and I no longer have to have that hiring freeze in March. Maybe things look better with the governor's revise in May. We're just waiting to see how it shakes out. So here's the service delivery. So you can see child welfare is doing what they need to do. There's really no other option. We always want to make sure foster care is placed in Lake County if possible. So 70%, not terrible. We'd like to increase that. Adult services, again, responsive. In-home supportive services, we've got 2,492 recipients. Brings in more than $5 million to the county in wages to the providers. I don't know, let me read it line by line, but Medi-Cal, we've got about 50% of Lake County enrolled in Medi-Cal, about 30% of Lake County enrolled in CalFresh benefits, brings in about $35 million a year. CalFresh, we had 94, these are averages, unless it says yearly, averages for monthly. So we have 94 people exiting CalFresh per month due to earnings on average. There's a typo. We do not have 22,000, my fault entirely. 22,000 people on CalWorks. It's 2,458 people on CalWorks. This is the program for people with dependent children who are working on finding gainful employment. And it is a shrinking caseload, largely in part, I think, due to the fact that it is not a large benefit. You can probably not find a house for what it pays. So it's less useful than it has been in the past. It does issue about $10 million in benefits yearly. We saw 24 people leave this program per month on average. Our Section 8 housing vouchers is a concern coming up in the budget year. So one of the goals we have for a legislative priority is attempting to protect Section 8 payments. It's looking like they're going to be reduced to 87% of what we are getting. Mendocino County has already made some steps towards addressing that. We are waiting to know for sure, other than we've paused issuing new vouchers. What will have to happen if it's reduced to 87% under our plan is that the people receiving the smallest vouchers will come off the plan first. As soon as there is additional funds, they will go back on to Section 8. And then internally, I'd be looking at other resources to help bridge that gap for those families. I mean, some of it is like a $16 voucher, so not a huge impact. But when you're looking at $16 vouchers and having to make up a $20,000 gap, that ends up being a significant number of people, perhaps. So we'd look at things like, can we help them through the Home Safe program if they're aged or disabled? Or is HSP an option through CalWorks if they have minor dependent children? So we do what we can. Not looking great there, though. In general, though, I do want to look at the Lake County Housing Authority, get some board meetings going. You guys are the board for the Lake County Housing Authority, and get some directions from you on where we want to go to make it more effective. So coming soon to an agenda near you. And that's about all I've got, unless you have questions.
Supervisor Sabatier,
Yeah.
you have your pen up?
I had a question.
No, I'm sorry. I just rattled on.
I was watching you and you didn't look over.
Completely failed my 7-minute test.
I do appreciate the numbers for left due to earnings to let us know who's actually graduated up above rather than fallen out and possibly through the cracks.
Yeah.
So I appreciate getting those numbers. I don't know how I can evaluate those numbers quite yet, but at least if we get those year to year to year, we'll be able to really have an analysis to see, are we being successful? There's so many outside forces that deal with this that it's not the department's not being successful or successful thing, but it at least gives us a little bit of a compass as to where we're going.
Yes, and these are monthly numbers, so multiply it by 12 if you want to see who is leaving on average yearly. In the CalFresh program, there's also churn reports if you want to see who is leaving and then coming back, because that is also something the state and advocates are interested in, who leaves but then doesn't make it and comes back.
Right. And my question was, the IHSS, is that also potentially on the cutting board as well federally?
It will be impacted by Medi-Cal cuts because you're required to be enrolled in Medi-Cal to be IHSS eligible. There are no cuts that I'm aware of to IHSS funding other than potentially the OMB order. Got to figure that one out. But the major impact would be if there is cuts to Medi-Cal, because our IHSS touches Medi-Cal.
Thank you.
Because basically, if someone doesn't qualify for Medi-Cal, they don't qualify for IHSS.
Absolutely, yeah.
Okay.
If you do not qualify for Medi-Cal, you do not qualify for IHSS. And if the Affordable Care Act was repealed, we would see more people eligible with a share of cost, where you have to pay out of pocket at a certain point to get your coverage, and that is also a barrier to receiving IHSS, because you've got to pay your provider out of your pocket for your share of cost before the state will pick up the difference.
Well, thank you for that explanation. I'll open it up to the public if there's anyone that would like to comment on this presentation. Anyone on Zoom? Well, I'll close public input, and thank you very much, Rachel, for your presentation and discussion. A lot of this is very important to our county here, and so thank you for the numbers, thank you for the explanation.